Hi, I'm Dr. Tanya, and I am here to teach you everything you ought to know about hypertension management. I am a clinical scientist, and I've done research over 10 years, and I've found some interesting things about hypertension and blood pressure control and medication taking behavior. I would like to share with you all of the information I've found, as well as all the information that's out there that will help you get control of your blood pressure. Stick with me and we'll take this journey to help you improve your blood pressure. Thanks for listening. In this episode, I will tell you how the coronavirus makes you sick and what to do if you get sick with the virus. Now, we all know coronavirus is also called COVID-19. It is a very contagious respiratory virus that is now a pandemic. The World Health Organization declared COVID-19 as a pandemic on March the 11th, 2020. According to the Center for Disease Control and Prevention, also called the CDC, most people who are confirmed to have COVID-19 are not severe. They have flu-like symptoms and they are being treated at home. Now, we call them the mild cases, but about 14% of people have a severe case of the COVID-19 and they are hospitalized. There are 5% of confirmed cases who are critically ill, and they are hospitalized in the intensive care unit due to respiratory failure from the pneumonia. Now, the difference between the people who are in the hospital and are on the regular floor versus the people who are in the hospital in the intensive care unit, the difference is that the people in the hospital on the regular floor, they have pneumonia, but their pneumonia is controlled, where as their body is responding to the treatment and they are able to breathe without any problems, any difficulty. Now, the people who are in the intensive care unit, their pneumonia is at the point where their bodies are not able to handle the virus, and so their lungs are filling up with fluid and inflammation, causing it very difficult to breathe and causing their oxygen level to decrease less than 90%, which that is requiring them to be placed on a ventilator, or if they're weaned off the ventilator, they're being monitored in the ICU to make sure that they can handle or they can breathe on their own. So what are the symptoms that you need to be looking out for to determine if you're coming down with the virus or not? Most people with COVID-19 have a fever of 100.4 or higher, followed by a dry, hacking cough and or a sore throat. Now, a fever for you may be different than a fever for me. But take into consideration if you have hypothyroidism or some other type of disease that causes your temperature to run low generally, then you would need to know what that temperature would be for you, because it probably won't be the 100.4. It'll probably be a lower number in order to determine if you have fever or not, like maybe a 99.4. I don't know. Only about 5% of people with COVID-19 have a runny nose or sneezing. So the average person with COVID-19 will not have symptoms of a runny nose or sneezing. So let me tell you how the virus is being transmitted. Dr. William Schaffner infectious disease expert from Vanderbilt University, says that an infected person's exhaled air contains tiny particles of COVID-19. And if you are within 6 feet of the infected person, you may breathe in the COVID-19 virus from that person. The virus gets in through your nose or mouth. It can also be transmitted through your eyes, but it gets in through your nose or mouth, in the back of your throat, and it goes down into your chest, and it causes inflammation in your bronchial tubes that provide your lungs with air. This inflammation is in your bronchial tubes, and it's causing you to cough, and that's what's causing the hacking cough. And he says COVID-19 spreads throughout the body, which makes you feel fatigue and sick, and you just don't, you're sleeping all the time, you don't feel good, sort of like the flu symptoms. The more serious phase of the disease occurs when the virus travels down to your bronchial tubes into your lungs, and it causes pneumonia. And so this is when the disease is spreading and it's causing inflammation and fluid in your lungs. That's all pneumonia is. It's just fluid and inflammation in your lungs that is causing difficulty breathing. Since we know that the COVID-19 deposited in the back of our throats through our nose, and it's causing all this inflammation, one would think that you could just gargle with some salt water, Listerine or Dr. Tishner's, or you can use Advil, ibuprofen, or some NSAID in order to prevent the disease or the virus. But to my knowledge, there is no information out there to support doing any of these things. But we do know social distancing, frequent washing your hands, D3, zinc, and vitamin C, and hydration may keep you from getting sick. If you think you are getting sick with COVID-19, stay home, take your temperature, and call your doctor or healthcare provider for instructions of what you should do next. Stay away from all your family members who are in the house with you to keep them from getting sick. There are telehealth services in place at some doctors' offices and clinics. This is a service that will allow you to do like a FaceTime visit with your doctor or your healthcare provider using your phone in order to get more information to determine if you need to be seen in the clinic or in the emergency room. Your doctor or your healthcare provider will also know where you can get tested. They would know the quickest way to obtain health care for you. And they also can call ahead at the healthcare facility in order to expedite your care at that facility. Your doctor also can call you in a prescription for medication to treat your symptoms if you don't have the COVID virus, and these symptoms can make treating these symptoms can make you feel much better. Don't just stay at home and watch your symptoms worsen. Call your doctor or healthcare provider for help if you think you have symptoms of the COVID-19 virus. In summary, if you think you are sick with the COVID-19 virus, stay home, take your temperature. If it's 100.4 or more, or if you're having the hacking cough, sore throat, runny nose, or even some of the minor symptoms, and you feel really bad, you need to call your doctor for medical advice. Follow your doctor's advice. If your symptoms worsen, don't hesitate to call your doctor back again for further instructions. Stay tuned to the next episode of Hypertension Resistant to Treatment, where I will talk more about COVID-19. Thanks for listening.